Well, colleagues, ladies and gentlemen, chairwoman, it's a great pleasure to be here and great honor actually to be here. And I was we were just chatting over dinner, and I remember our first meeting. It was a summer warm day in a hotel in Heathrow, and I think there must have been about 15 people around the table. And isn't it great to see so many people here? I think that's a fantastic testament to everything that the charity has become. So well done, Deborah and trustees as well. So when Deborah said to me, would you mind saying a few words? I said, yeah, sure, that's not a problem, happy to help out. I told my son, and he said, oh, Dad, you're speaking again, my God, right? My children are like, he said, who are you speaking to this time? I said, oh, it's a group called the ALKs. And he said, oh my God, what are you doing? I thought you were an oncologist. So I had to explain to him exactly what this is all about. So one of the great privileges about being an oncologist and being a physician is that you see people from all walks of life and you experience life with them. And you experience life with them through their journey over a period of time. And we witness great changes over this period of time. I mean, huge changes. When you're a bit grey-haired like me, you can remember a telephone being something that you put your finger into the dial and then you turned it round and round. And then there's people in the audience thinking, I'm crazy, what the hell am I talking about? And now we have this thing in our pocket called an iPhone or a Samsung or whatever it is, and it can do everything. I can send emails, I can do that. That is the scale and pace of change in domestic technology and science. You can imagine what the pace and scale of change in medicine has been at the same time. And all of you are a testament to that change. And all of you are a success because of that change that we have all together witnessed. And I think that's a fantastic testament to where we've got to. Because when I started my career as a oncologist, I've been a doctor for about 25 years, lung cancer was a terrible disease to be told that you had because there wasn't any treatment. We divided lung cancer into something that was treatable, something at those days called small cell lung cancer, and everything else wasn't treatable. And that's where we came from in the late 1990s. And I remember being a young oncologist working with my boss at the time, Mary O'Brien, who's a pioneer in her own lifetime. And we came across, cases, people, individuals who had got lung cancer and they'd never smoked. Or if they had, it would just be a few crafty cigarettes in the university. Everybody does that. And we didn't understand why this was happening and we couldn't treat them differently. They just looked exactly the same. And since then, we've had a total revolution in science. We've had the iPhone moment, where our rubbish Bakelite telephone has gone out, and we've replaced it with state-of-the-art modern technology. And that has been applied to the science of what we understand now as the cancers that we deal with. And in that period of time, we've had huge progress. We've had something called the Human Genome Project. Now, I don't know about you, but I must have been about 20, 21, something like that, when the Human Genome, actually a bit older, 24, something like that, when the Human Genome Project reported. And I remember watching it on the news, and I can't remember who was doing the BBC at the time, came on. And I thought, wow, this is great, but this isn't going to change our life. I mean, how's this going to affect any of us? If you fast forward a few years after that, there's been changes in what are called medicinal chemistry. So if any of you got any children and they want to do chemistry, please let them do chemistry, because not only will they be brewing their own alcohol in your garage, but they'll be potentially turning into a medicinal chemist. And the medicinal chemists are the brains in the outfit, because the medicinal chemists take these chemicals and compounds and turn them into drugs. And these medicinal chemists then liaise with the scientists to work out who needs these drugs. And then they come to us as the physicians, and then we do the experiments, and then we take things from there. So that's the way the whole party works. And when I look back and I understand the science of the human genome, We understood what genes were in human beings for the first time at that time point. A few years later, we were able to map that to work out what had gone wrong in patients' cancers. And at the same time, medicinal chemists were coming up with these great new chemicals, which were called TKIs. And we were able to put the two together. And in a disease called chronic myeloid leukemia, not this disease, we were turning a leukemia in which patients needed to have a transplant of their immune system. And believe me, that's a really tough treatment to go through. That's a bone marrow transplant. Into a disease that could be controlled for 30, 40 years with a simple tablet. And I was a young boy at the time. I wasn't that young, but I was a hematologist at that time, working in Duquesne Road at the Hammersmith Hospital in Acton for my sins, next to the Wormwood Scrubs, and I can tell you a few stories about that if you want to know. And I remember looking after the hematology patients undergoing the transplants at that stage, and I visited again a few years later, and the ward had been cleared out because they just didn't need the ward anymore because people were just taking a tablet in the outpatient setting. That is the scale of progress. And never did I think that we would be applying that same technology to the never smoking lung cancer patients that me and Mary were looking after in the clinic. But we've had huge progress, and we were able to work with a variety of different companies to develop this agenda of treatment further. So the first report of ALK being abnormal in lung cancer was in the early 2000s, where a Japanese group took a sample of a cancer from actually a Japanese male smoker. And they put the cancer in a mouse, and then they looked at the genes of what was going on in that cancer, and they found that it had this abnormal genetic code called ALK. And as it happened, they screened a whole bunch of chemicals using their medicinal chemists, and they found a chemical called PFO2341066, which happened to shrink these cancers down. And that chemical was manufactured by Pfizer. And Pfizer had this chemical, and they actually wanted to use it in patients which had an abnormal gene called MET, M-E-T. And the Japanese guy said, hang on, you don't want to do that. You want to try it in these. And to all their credit, I mean, we say a lot of things about pharma, but to all their credit, Pfizer then changed their entire development program to use this chemical PFO2341066 in patients with ALK positive lung cancer. And these patients had spectacular benefits. And that drug is now called crizotinib. And that was the first licensed ALK inhibitor that was developed. And at that time, this was really exciting for us because we were seeing really difficult things happening to our patients. And we were able to implement ALK testing, one of the first centers in the UK that were able to take a patient sample and look for this abnormal ALK gene. And we were able to get hold of crizotinib by hook or by crook, usually by hook or by crook rather than the conventional methods, and give it to patients, and we saw amazing things happening in front of our eyes. Isn't that fantastic? That's just wonderful to experience as an oncologist, because that's a step change moment in our life as a professional, and of course in the lives of the individuals that we were lucky enough to find and treat. And since then, we've had huge, huge progress. We've had crizotinib, we've been using it in routine day-to-day care, but we didn't really understand much about this disease called ALK positive lung cancer at that stage. We didn't understand who it affected, what its natural history was, and we've learned so much. We've learned so much about the disease, about the drugs, about what it does if left unchecked, and the side effects that the drugs cause. And at the same time, we've had huge advances additionally in medicinal chemistry, and additional drugs have been developed. There was a drug called CH5424802, snazzy name. And I was invited to discuss it and another drug, AP26113, and another drug, LDK378, in a meeting in Stockholm. And it was in the experimental drugs discussion session. And this session is normally really quiet and very few people attend it. This hall was packed. It was standing room only because it's the first time data on these 3 drugs were presented. And this, the C drug is a drug made by Chugai, which eventually has been called alectinib. The AP drug is a drug which has subsequently been developed by Takeda, is called brigatinib. And the LDK drug is a drug called ceritinib, which was then developed by Novartis. And what was absolutely astounding was the experimental data that we had on 10, 20 patients who had these drugs, where the vast majority of patients were having tumor shrinkage. And everybody left that room really uplifted, thinking we're going to make a big, big, big difference. And indeed, I think we did make a big, big, big difference, because these drugs were then rolled out really, really quickly into routine clinical care, routine practice, and we've been using them thereafter. So what have I learned over the years? I think the first message that I've learned is that we need to believe in science, because none of these advances that we have witnessed, and let me tell you, we have witnessed step-changing advances in my professional career, which I never would have thought we would have achieved. None of these advances have occurred through chance alone. None of these advances have occurred because somebody's thrown a massive amount of money at a problem and they've just gotten on with it. Actually, it's been through thorough scientific endurance, intelligence, and actually the goodwill of folk like all of you in the room who've put themselves forward for research. Because only through research can we actually identify what works, what doesn't work, and what we should be doing and what we perhaps should not be doing. And then we can make these advances. So these changes that have occurred have only really happened through the huge advances in science. And looking back and looking at the change from the telephones to my iPhone in my pocket and the development away from chemotherapy towards targeted therapy, I have every faith that the next 15 years are going to bring yet more step changes in the treatment landscape, not only for ALK positive lung cancer, but for many other types of lung cancer that we see. The other thing I've learned is that we need to listen. And we need to listen to our patients, because actually, for us as physicians, our patients are telling us way more than we're reading in the data. So when we listen to our patients, we learn lots. We learned, for example, that you can have blood clots with ALK positive disease. That wasn't in the data. We learned about lots of side effects that isn't in the data. Deborah, you've done huge amounts about establishing what the side effects are so that we can understand these better and work out how we use these drugs the best. And we've learned about why some patients do well, and we've learned to reflect that actually not everybody does as well as we'd like to hope. And we always take a brief moment to think about those that haven't done as well as we'd like to have done, and think about what we can learn to make sure that everybody else has the best chance moving forward. But the most important thing that I've learned over the past 25 years of being a doctor and 15 years of being a lung cancer expert is actually the power of change comes from everybody in this room. It certainly doesn't come from me. Because all of you together have a huge amount of power to change massive amounts of policy within the UK landscape, to change how industry works, to change how the NHS works, and to change what your oncologist does. Because one person just saying, I want to do X, Y, and Z isn't going to do anything. But a national charity saying this is what we believe should be done, backed up by a group of experts, has huge influential power. And I was just really delighted to learn that ALK Positive is now a recognized stakeholder with NICE and has a foot on the table at many other stakeholder events. And I think that's a great credit to the organization. So where are we going? What does the future hold? I think all of us should be excited. And we should be excited because the step change of pace we have seen in the past. And it's not just for targeted therapies. I remember sitting in a room in Chicago where we had the first data presented on immunotherapeutics. And this is many years ago now. And we were seeing the first signal that drugs that modulate the immune system were starting to work in patients. And this area undoubtedly is going to galvanize and be the next step forward in all types of cancer. And I'm sure it will also include ALK positive lung cancer, where currently immunotherapy doesn't seem to have a major role. But there's a huge amount of work being done in trying to look at that. We're actually doing a huge amount to identify patients, because all of us, before being diagnosed, we're a potential patient. I could be a patient tomorrow. There's a huge amount of work being done to pick up cancer early, to prevent it from occurring. For example, we're investigating lots of technologies such as early blood tests, where you can walk into Asda, for example, or whichever supermarket you go to, have a blood test, finger prick, and find out whether there's something bad going on. And that technology undoubtedly will revolutionize how we access healthcare over the course of the next 20 years. Undoubtedly, we will be curing more people. One thing I've never thought I would say is that we are curing stage 4 lung cancer. I'm sure we are. I'm not sure who we're curing, but we definitely are curing some people. And I think that that is a really important message for you to take home, because the future is definitely bright. I just want to close by saying a few words of thanks. First of all, I think all of you in this room are absolutely tremendous. Your passion, your dedication, the fact that you're actually here is a huge testament to the power that you can achieve as a group working together for a common cause. ALK Positive UK has been a tremendous charity for doing great work, I think, in this area. And I really wanted to say a vote of thanks to the Board of Trustees, and especially to Deborah, for a huge amount of effort that you've done. Deborah, well done. And with that, I'm sure we can make a difference. And I would urge you to perhaps grab your glass. I think it's time for a toast. And a toast to science and the future. Science and the future. And with that, have a great evening.